just means a sector-wide approach. It's an approach.
Some details of some new disease that rats are. What's that? Find some of these influencers. Work with them to be able to amplify.
Chairman,
Yes, sir.
can I just quickly respond? Quickly.
1 minute.
1 minute.
My honorable colleagues, our honorable minister and your team, Honorable Dr. Jeremiah Omoru Isi is my name, and I represent Akwanga Nasarawa Egon, Wamba Federal Constituency. I am from Nasarawa.
Our secretariat, we were not introduced. I think it was an oversight, so clerk, please.
The budgetary allocation for the sector, for the Ministry of Health headquarters. Well, I was going first to 6 to just give you a summary. It's 186 billion for capital, multilateral and bilateral 25 billion, overhead 1.5 billion, just similar to what we had in 2025. But you recall 2025, half of it was mopped up, and personnel costs the same as we had last year as well. Total allocation was 228 billion, and the big picture is that because 2025 had not been released, touched, it has been rolled over to 2026 and at a lower level with slight discount. What we can only work towards is to ensure that with resources being available, with the new direction that only projects that have resources should be awarded.
One thing I wanted to understand is that for some of us that are even in the health sector, Abuja declaration was done in this country here. And then up to today, many countries have gone to move their budget up to over 15%. But for many years, the budget of health is still less than 10%. And our population is growing in millions. And we are dealing with a budget that is not growing in proportion with the population. So we need to understand that in budget. And many of the things, I'm quite aware, if the intervention we did in health institutions, if the budget of 2025 was fully funded, there was no request for, when we had an interaction with the head of agency, that means the teaching hospital and so, anybody that asks for house quarters, we approve it for them. Because we knew that that was the only way to expand the carrying capacity of many of the teaching hospitals. If the house, no request for house officers expansion was denied, because we know that except you do that, you cannot have that. But I am in this position to tell you, sir, the majority, not all, of the problem we're having, especially in Abuja, is that people have waited here for 1 year, trying just to get into FMC Jabi. In fact, I've had people that I say, go to Gwagwalada. They say, no, how can I go to Gwagwalada? I say, there is a provision in Kefi. Can you go to Kefi? No. How can my children go to Kefi? And that's one of the major problems we have.